stop her or something like that, because I just get this sense there's a thread of her own experience that took her over an edge that she may have not felt ready for, and if she's blaming the therapist, there's still the edge of fear that's underlying rather than seeing her part and choosing. So there's something interesting in that I'm still wrestling with.
Because I feel that about so many therapists. It's so much their own projection, what their own work is, and especially when they're so attached to certain things.
Right.
And I don't see that as much with Dawn, except in the spirit consciousness sense. But it's not necessarily being attached to it, but that being, theory of practice and like way of life, and I don't know, healthy.
I've wrestled with him. I've totally wrestled that. I'm in my grief, goddammit, and you want me to get bigger than this? And I'm listening to you getting bigger than it, but I'm not. I'm right here. I'm like, and he's not even arguing with me. I'm having my argument with Dawn in my head, right? That spiritual part is not cutting it right now. And sometimes I think that is looked at as we're going to bypass the grief. Yeah. We're going to skip over the pain, and we're not going to be there. And that was what I wanted. I didn't want to be sitting in my grief month after month after month. Of course I wanted to jump, right? And it's not that you're inviting us to jump. I do imagine we're inviting to get bigger than it. And at times I could, and other times I wasn't meant to.
Right.
So I know in the last several months of last year into this year, I was wrestling with that idea too.
It's a dance for me. It's like if you've been traumatized from a loss of a loved one or from abuse from your past, it's such pain that you don't want to go into it. Mm-hmm. So how do you help people go into the pain knowing that the only way through the healing is through it? So there's a dance. So if you invite people toward the pain, they only have a certain amount of resources, or they only have a certain amount of tolerance for pain. When they hit that point, they don't want to go through it. And even if you're encouraging them to go through it now, which is one of our jobs, to encourage them to go through it, you have to respect that they put on their brakes. And that's when you have to say, okay, maybe you need some more time feeling this grief. Maybe you need some more time. So then let's swing out of this back to a place of ease where there are less pain, more resources are waiting for you here. Mm-hmm. So there's this little perambulation, I think, called it. We went to a workshop with, who does trauma work?
Levine.
He talks about a perambulation. But for me, it's just about watching the client hit a point where they're no longer willing to go into it deeper than they're willing to go right now. Then stop right there. But don't back off. Just stop. They'll sit on that edge for a few seconds. And then they'll start to pull back because it was too much. Then you want to join that process of pulling back. So we're still going to follow the process of toward and the process of back. And it's going to look different for every person. But here's what happens. When clients get into this point of threshold where they feel a little bit more pain than they want to, when they come out of that, that can turn into blame and anger and look what you did to me. And that's what everybody's afraid of, that the client is going to turn on them because somehow they didn't do this right. So the right is to watch the movement and stick with the movement and stay with the process. But the client sometimes will move in, and sometimes they'll surprise the hell of you, and they'll go right through the trauma to the other side. But not many people want to risk that, for fear of hitting this threshold will cause reactions that they don't like. So how do we train therapists to say that any reaction is okay? No, we teach that. But how many clients get it? Interns get it. Any reaction is okay? My client being mad at me? My client accusing me of re-traumatizing them? My client saying they almost died and I don't know what I'm doing? You're telling me all those reactions are okay? And I think a lot of therapists out there don't believe that those reactions are okay. So therefore, your job is to prevent your client from going that far so that they'll have that reaction. Now they're teaching co-behaving. And they're teaching you not following the client's process anymore. Because sometimes you'll follow the client's process in too deep for the client. The client will go too deep for themselves, right there in the room with you, and all you've been doing is inviting them to connect more deeply to the trauma. And then it all backfires on you, and we're all afraid of the backfire. But the backfire is also part of the recovery. So the client has to learn that what happened to them. And when you can get them into taking responsibility for them rather than blaming you, they can actually start to monitor their own journey toward and through the trauma. And that, because we've never been responsible for that journey, we join a journey. We're never responsible for the journey. But we join the journey, and the idea is join the journey in the direction it's going. Mostly, even if a client's coming in and denying the abuse, join the journey in that direction, because that will take them, as they get further away from them, they'll hit a point going this way too, where they say, this isn't it, or they'll hit the point going this way, this isn't it. So there's this arc here, where you have to be willing to see the arc and the direction the client is going in the arc, so you can join the direction as well as the depth. That's the dance that I try to help you visualize that's going on here. Does that make sense? But how to do that, and the art of doing that, it really takes a lot of training to learn when you see the client has hit an edge but they're still okay, or they've hit an edge and they're not still okay. You've got to be able to see things that you've trained yourself to see. So instead of training you, I'll make up rules for you. Don't do that. Don't go there. Don't go that far. So now you're safe behind rules. But I'm not teaching you to be more exacting in your watching of your client's process. I'm letting you hide behind a set of rules here. And I don't want you to do that. So there's risk to everything. And there's risk to healing. And isn't the risk worth it when people heal? I've had many people in my practice heal. I've had them move through. See, I'm secure in knowing that people do move through the worst of traumas. And I didn't know the exact path. We fumbled around together for months, sometimes years, trying to find that journey. And I didn't know, and they didn't know. So we've got to be willing to stumble too. But do you like the idea of saying, therapists stumble? Therapists don't know. Therapists be willing to do it wrong. Therapists, there is no wrong reaction. So I think the paranoia comes from not feeling in control. And we want you as therapists to feel in control. And this whole teaching thing is about you being in control. BBS says, be in control. And you can't be. Well, how do I take that away from you? How do you invite clients to let go of that? Interns, therapists, to let go, that they're not in control. They're not even in control of their own lives.
There's the
Let
existential
alone somebody
crisis.
else. So I think there's a whole lot you have to teach here. Not just the technique, but the whole attitude that you hold with them, you know. The whole attitude not only you hold with them, you hold with yourself. Because it's an attitude that says, any reaction you want to give me is okay. Killing yourself isn't one I prefer, but it's okay. Hating me and reporting me to the BBS is one I wouldn't prefer, and it's okay. If you can risk those, then you can risk the possibility of healing as well, the other direction. So I think that's one of the reasons there's so much paranoia around it.
I also see, as you mentioned earlier, the backfire. The more comfort we have in our own backfire and in our own reactions to backfire, I think the more ability our container can be as large and open and non-resistant to whatever's going on with the client in response. And how do you teach that? I mean, I don't know that's really, how are they experiencing that in their lives? Feels like the bigger, I mean, you know, like we could teach it, but for them, it's more about their experience.
I try to teach all is well all the time, but I get a lot of flack and resistance for it too. What do you mean all is well? Murder is well? Rape is all is well? Yes. But it's, So you can't teach this stuff. Best you can do is, while they're interns, guide them into and help them survive, see that they've survived it. So the experience of moving somebody toward trauma and having it go faulty is survivable. And having it work is rejoiceable. And how do you have those experiences? That's why we have a mirror program here. So we can hold on to these interns as they take steps into new territory. So they can figure this out. And some won't. Some won't go. And there's nothing I can do about that. I don't even feel sad about it. I used to. I don't anymore. Some people don't want to go. They're too scared. And as far as I'm concerned, you get to be too scared too. I'm not going to stop teaching it, that's all. I'm not going to co-behavior scare. I'm not going to explore and I'm not going to justify your scare for you. That's what I'm not going to do here. So I'm going to invite you into your own fear and looking at your own fear while you're here. I'm hopeful that's what you'll do too. This is what this model is teaching people to do. Because in order to let go of your identities, you have to go beyond them. In order to let go of being a good therapist, you have to go beyond being a good therapist. Or that identity doesn't die. And if it doesn't die, you're not as good a therapist. So it's really hard to help people step beyond these boundaries that they felt to keep them alive and safe. Step beyond like you're jumping over the cliff. Jump. Now you're falling and nobody knows what's going to happen next. That's an existential exercise. So.
Would have been nice to name that in the room as it was happening. Oh look, we've all jumped over the edge. I wonder what's going to happen.
Now sit in the room in that fall.
Yeah, what's happening right now?
In the fall, just not know while you're with a client. Be falling. The only ground will be your ability to trust and know that you can follow your client's process. They will be your leaders when you fall. You don't have to have a place to go. So I don't think I teach here responsibility here. What I think I teach here is a close, precise skill of monitoring and following and your client's process wherever they need to go.
So the analogy that Babette responded with is, if I have a young boy with matches in his hands, I'm going to take the matches away.
Who said this?
Babette, the trauma
Oh, okay.
woman.
Pretty concrete.
Yeah, and so my wrestling with that is, it says if we have the power to take the matches away, what if the client's going to go play with matches anyway? You know?
What if that makes them even more curious about the matches?
Right?
Yeah.
That's how my brain works.
Right. Right.
Or the matches are a signal for something else is wrong.
Mm-hmm.
And we just see it as this boy wants to strike matches. Wait a minute. All the fear or anger or rage that's underneath striking matches gets left behind because just stop them from then lighting the match. If that's all we had to do, then just say, stop letting your clients re-experience their traumas. Stop it.
Because they're not, because the idea is we'll know when they're ready.
Yeah.
That we need to know they have the resources.
Yeah. So rather than take away the matches, I'd like to sit with this kid and say, I wonder what's going to happen if you strike up those matches. What you want to, or maybe you want to put see what it's like to put them away. See what it's like to strike. But there's some danger. I want you to know there's some danger here. You might get burned, and we might end up in the hospital. But so they don't see it as a process. They see it. You are the safety, and they're trying to make you the safety here. Can't possibly be the safety here, but you can be a very keen observer of the process of your clients. And that's what I would like to hold you responsible for. Your ability to see and to adjust to the client's motion and movement. Not the client's. So I don't know how to present that or teach that in a way that relieves anxiety and angst because there's a lot of attachment to anxiety and context when it comes to trauma.
I'm thinking just to witness a client doing work with trauma and going through it. I think to see it happen for me then gives me puts in that this can work, or this does feel okay, or I like to see it. Is my thought, which happens I think in the mirror program.
Yeah. To be experiencing it with the client is even deeper than seeing it.
Yes.
But you really have to have faith in somebody behind that mirror.
Right.
Faith that goes beyond your own faith in yourself. I trust that Donna's going to be able to help me get this client through this trauma, even if I can't. And that's the observer position, and you're giving me the power of the observer, which you need to do it at first. I need to be your observer. Then you begin to own that observer back again.
That's what I did, I think, when I was in the mirror.
Right.
And you're saying some interns, they wouldn't trust, or they wouldn't say, oh, I know that I can rely on Don here and he'll help my client get through the trauma.
Right.
They're still too scared. They're scared even with you in their ear.
Right. So if they can find another way to at least get bigger than their fear for just a moment, if they won't use me, will they use some other, maybe a spiritual experience, or speaking with an angel, or having a guidance system come down and say, you're going to be all right. Something that, if they can have a spiritual experience, that can also be enough for people to shed their terror just long enough to risk going into that trauma with the client. Because they'll never find out unless they go in. And I think there's a great majority of therapists here who don't go in and have never found out. Trauma is something you stop, you put controls around, and you treat it behaviorally. And you teach management of trauma. The EMDR says let's deal with trauma in an unconscious way. They're dealing with trauma. And then Bandler and Grindler, who do all this NLP, they do trauma work through neuro-linguistic programming. And they work with it, but not consciously in the moment experiencing it. So you see, so this is a dangerous kind of model for if you want people to experience the trauma in order to get through it. But if you don't need them to, it's nice to see if you can do this. And it works for some people. It's the same as the observer position. So I think you can do it in a variety of ways.
Well, the idea too is that if they're experiencing it with you, it is going to be different.
It is, yeah.
I mean, it's naturally different because you're a witness through it, and you're inviting other things which maybe they haven't had those opportunities before, whether they take them or not.
Yeah.
I mean,
Your presence makes a difference.
Yeah, like it's just naturally different. But then there's those things when they play out the trauma towards you that sometimes you don't even realize or loop back into the trauma, or we haven't had, I don't know, a book on them yet to know exactly every little facet of their life or something, to know how and when it's going to come out. I think that's the difference, is that I guess the other models, you assume you're the expert, you have to do a lot of research on them ahead of time to know how it could come out and when it does and what to do, and then it's all, and then you could get kind of locked in the theory of it and not in the experience of it. And here you don't really need to know a whole lot about it to still replay it differently this time.
We don't mean to, but we hide behind textbooks. We hide behind concepts. And we let the concepts be who we are rather than the experience. And I think sometimes that opens people. I don't want to be negative and say textbooks are not, information isn't good. It's just some people hide behind information, and other people use information to take the necessary risks they have to take. So it's like anything else. It can be used poorly or it can be used well.
I'm thinking about a couple families with reunification sessions that I've had lately, which feels like they have to come right into the trauma and they don't want to. They want to just let it go, especially the family we're seeing. And there's a couple others, they just want to let it go. They don't want to talk about it. They don't want to confront or face it, even though they have all this other stuff left over from it that hasn't been resolved or integrated, but still kind of dangling out there. That feels more dangerous, being unconscious about it. You know, that it comes out in acting out in other ways. It comes out in lying and all kinds of stuff. But when they get to session, you know, they just want some fun times. They don't want to
Make
go
this
through
a
it.
pleasant experience for me, please. I want my healing to be comfortable and pleasant. Yeah. Well, you run into that in your parenting class too, when parents get so identified with their kids that they give up their own internal fears and traumas that are driving them as a parent. And they project all of those fears onto their child. And now they fear for the child, and so they've just displaced their fear because they haven't looked at their own fear, their own trauma, their own pain.
Right. That's what the dad does a lot, is put hidden fear onto his kids often. Yeah. Tries to protect them, but it's colluding with what originally happened. Yeah, it's just so interesting to see that edge. I like how you describe it.
It's good because the projection shows you and them where they are. It's just so often they won't own the projection back. So they're left projecting out and being impotent in their projections.
When I just love the way you describe that whole process of inviting them to the edge and staying with them as far as they go, and they might have to backpedal a little bit, but continuing to be there. And it's okay to be in that discomfort, and you know, all the things that you said about it are just, I know I keep that with me when I'm in those sessions, and I'm tempted to just want to back off the edge. I'm tempted to just want to enable or co-behave, or but at the same time, there's something in my gut that tells me that's not the right thing. It doesn't feel right. It feels like I'd be overlooking or repressing or ignoring or something. So I love that reassurance that you offer around that. I think that provides a sense of safety within me, and I can, you know, bring that to the room.
Yeah. There is something to watch for. It's not all chaos. You know, there is some order. But what order can you affect? That's rather than what order you can get your clients to affect. So, doing what you can, knowing what you can, observing what you can, and then letting the clients work. Don't take responsibility. Okay, we can continue to talk.